Hello and namaste. I'm Dr Bishal Gyawali, a medical oncologist from Nepal, currently working as an assistant professor in Queen's University, Canada. We are here today in New Delhi on day 2 of ecancer Choosing Wisely Summit. And joining me today is a very rising young superstar of oncology, Dr. Arjun Gupta, who shares similar background to me. He's from India, New Delhi, and currently working as a clinical fellow in oncology at Johns Hopkins University. Welcome, Arjun.
Thank you so much. Absolutely fabulous to be here in my hometown, just 2 kilometers from where I grew up, did medical school, and can't believe that this is happening so close to home.
Yeah, and yesterday I had a conversation with Dr. Ajju Matthew about challenges faced by young oncologists. So today I have Arjun Gupta to discuss similar issues from his standpoint as a clinical fellow in his career. So I hope you'll get different flavors of understanding challenges of young oncologists, especially in low and middle income countries, from these two conversations. So Arjun, let's get into the point. What do you think are the challenges of an early career oncologist as a clinical fellow in US versus in India?
Yeah, so I'm currently doing my DM or fellowship in medical oncology in the US. So whatever I've realized about practicing oncology trainees in low and middle income countries, including India, is just by speaking to my friends. But I think one of the biggest differences is how much focus there is on training versus clinical workload. I think that's one of the primary ones. So just to give you an example, is when I'm doing a half day of clinic in America, I'm perhaps seeing 3, 5, 6 patients in a half day. I am seeing those patients over the course of 2 years. They're my patients in my continuity clinic, so more long-term bonds and perhaps not as much clinical workload, whereas several of my friends here are seeing 20, 30, 40 patients in a half day. And I think that challenge of trying to fit in and address everything that you want to address, and more importantly that's going to benefit the patient in a 5-minute encounter, I think is just not as personally satisfying. I think that's the biggest regret that I hear from fellow trainees practicing in India, is they wish they had more time per patient.
Yeah, I do remember that once when I was on a phone call with one of my colleagues in Nepal, and he was asking me how was your day, and I was complaining, oh, we had 15 patients today and 2 of them were new patients. It was exhausting, and he laughed at me.
Exactly.
Yeah. So yeah, definitely huge amount of clinical load and not being able to follow the same patient over the course of treatment and understanding how your treatment made changes to the particular patient is definitely, I agree, one of the challenges of early fellows working in our part of the world.
And I'd also add, there's this thing that you need to have sufficient patient load to become clinically competent, and I fully agree. I mean, I did MBBS and medical school here, and I've trained in both environments, and I think seeing patients is very important, but sitting, reading, learning, evidence-based medicine, how to apply data, needs dedicated time as well. And one of the more important complaints that I hear from trainees here is they don't have as much guidance or as much time to sit down and really pore over the data. I was reading a stat the other day that medical knowledge is doubling every 2 or 3 years now, whereas it doubled from 1900 to 1950. So now we're in an era where there's so much new knowledge that having time and expertise to actually go through it and understand it is very hard. So to have that dedicated time, resources, mentors in your training period, which could just be 3 years, I think is something that I really appreciate having there.
Yeah, totally, I agree. I mean, I try to liken it to the saying, if you give fish to a man, you feed him for a day, but if you teach him how to fish, you feed him for his whole life. So I guess the training we get in low and middle countries is more focused about giving fish, saying what treatment you should do for this particular patient in this particular case, rather than teaching them how to have the skill set to understand what to do for a particular patient given the best available evidence at that particular time.
Which may evolve over time.
Yeah, totally, I agree with that. And so what do you think would be the solution to the problems that you have just described? What could trainees in India do to overcome the challenges?
So I'll say this, that especially visiting here for the conference and speaking to people, the grass always seems greener on the other side. So when I'm practicing in America, I think about home and seeing all these patients and the incredible pathology and taking care of very, very perhaps less fortunate patients and forming those deep bonds with them in India. And when I speak to my friends who are practicing here, they talk about all the scholarly opportunities available in America. So I think there's no perfect system at all. One thing that I've really enjoyed is coming to this eCancer Choosing Wisely meeting you, other people like you who've trained sort of at 2 or more locations. And most importantly, the trainees in India and from the SAARC countries who are here for this conference to just talk how I train, how they train, how I can incorporate some of the things that they're able to do so well, and how they can incorporate some of the things that perhaps we do so well. I think that's really important, is that people talk to each other, which conferences like this makes it possible.
Yeah, totally. One of the challenges when I speak with colleagues working in low and middle income countries is that they don't have a good mentor at their home place, and they lack mentorship for clinical care, for research guidance, and stuff like that. So I have been trying on my own to sort of virtually mentor young colleagues from low and middle income countries across the world. But I guess you brought eCancer conference, and of course we are conflicted with eCancer as a part of the board of the eCancer. But I guess that's where eCancer's online training and virtual education platforms play a very important role.
Absolutely. I mean, I've taken benefit of those videos myself in preparing manuscript preparation, how to submit. I actually did not know this, but they just launched a new or a relatively new journal as well, which allows open access publication, especially for researchers from low and middle income countries who are not able to pay the publication fees. They're able to help support those researchers as well. These are very tiny things, but very tangible things in which they can contribute. To give you an example about e-mentorship, there's around 6 or 7 medical students attending the conference here who came, all the way from small towns in Maharashtra, sort of taking the train for a day long and coming here just to meet people like you and saying that you're very inspiring. I'm seeing that from Twitter. So to be able to connect that way, and the singular piece of advice I gave them is don't try to do things on your own. I love their initiative. I love that they're trying to write a case report, they're trying to write a review, but I think we need more structured mentorship, which I hope that conferences like this can foster, that we can have meaningful relationships with these trainees.
Yeah, I totally agree. And as you said, the grass is always greener on the other side. There are always lots of issues with finding a good mentor, even in high-income countries like US and Canada. So I guess trying to make the best use of whatever resources you have locally, including mentorship, and trying to explore the global options. I mean, you don't necessarily need to limit yourself because you are at a low and middle income country. This is the age of internet, social media. So that's how I explore the world. So I guess, as I said in my talk yesterday, acting locally but thinking globally would be the way for young trainees in our part of the world to explore their career and explore other options.
And again, I think I've been very fortunate to have excellent mentors, but it's not like horror stories don't exist in America or the rest of the world. I think trial and failure is a very big teacher in all aspects of life, and I encourage all trainees here to keep giving it their all and never hesitating. I think that's one thing that's not taught to us here as well, is you don't get until you ask. And I think I learned that much later on in life when I moved to America, is that you have to take that first initiative. And most people in academic oncology in America especially are very willing to mentor young trainees. That's why they're in those positions. And so cold emailing people, reaching out to them can often pay dividends.
Yeah, I totally agree. So now that this is a Choosing Wisely meeting that we're having, what are your Choosing Wisely advices to, specific 3 advices for young trainees? Choosing Wisely 1, 2, 3.
In terms of what they can do for their career or for oncology practice?
No, in terms of, we have discussed a lot about oncology practice, and I guess that will be covered by the videos that will be on eCancer soon. But in terms of how they can further their career for trainees in low and middle income countries.
Well, I'll take a cricket reference first. In Hindi, the local team of Delhi is Delhi Daredevils in the IPL, and their slogan is "Khelo front foot pe," which says that you should always take a stride out and be confident and be positive in how you approach things. So I think this mentality that we're from a low and middle income country and therefore cannot be a big voice in global oncology is absolutely false. There's one great example sitting right here, and I think that mindset change, which I've seen happen for so many trainees, Bishal, in the last couple of years because of Twitter, I think that's my number one point, is just that self-belief that you can make a difference if you keep doing good work. I think that's my biggest piece of advice that I'd like to give trainees here.
Okay. You also wanted to talk, I guess, about clinical practice, and we had some offline discussion about how we always discuss about underuse of treatment in lower middle income countries, lack of access, lack of affordability. But we have seen that the bigger problem, especially in bigger cities like Delhi and Mumbai, I guess, also seems to be over-treatment, over-zealous treatment and over-diagnosis. Would you like to say some words on that?
Yeah, it's confusing to me. So again, I did MBBS here, and perhaps general medicine is slightly different from oncology. I think that aspect of desperation, especially with advanced cancer, comes in. I almost wonder if clinicians and patients here feel like not doing everything, especially when it's shiny and fancy and available in the West, is if they're providing suboptimal care and providing this so-called second-class care, perceived second-class care. Whereas you and I, who've perhaps been in North America and are seeing patients there to some degree, know that those therapies or those interventions are perhaps not the perceived first-class care and come with their own share of problems. I think people in India perhaps underestimate how much financial toxicity in our day-to-day clinical practice is rampant, even in America, and how just because I don't think drug X is a great idea for India doesn't mean that I think it's a great idea for America. I actually think it's more problematic to practice in America because I have to make that decision every day in clinic with the patient because that drug is available. I sometimes think it's better that that drug not be available.
There is no point in being sad that patients don't have access to ramucirumab or regorafenib for colorectal cancer in India.
I absolutely agree.
For the first time during an interview, I'm not the person who has to say those things, and I have somebody else saying those things, which is a very happy thing for me. Thank you very much, Arjun. You are so wise and you have such a bright career ahead of you. I'm so proud to see your journey.
I'm honored, and this is just partially because of Bishal. He's a very, very inspiring figure to not just me, lots of trainees across the world. So very honored to be here.
And I'm paying for his dinner tonight. Thank you.